大家好，我叫詹尊林，我是一个心脏专科医生，在新加坡伊丽莎白医院工作。那我的专业是做心脏血管如果有阻塞，我可以用球能用支架把血管打通。我也可以用同样的成型术把那个主动脉瓣膜如果是狭窄的问题把它换掉，不需要动手术的，可以把这个瓣膜换掉。我也有做这个左心房如果这些病人有心脏跳不规律的话，我们可以放一个
左心耳封堵
这个手术叫左心耳封堵。那最后的是，我是在伊丽莎白医院就唯一的心脏专科，我也可以，如果病人有脚血管阻塞，我也可以用球能和用支架把这些脚的血管或者颈项的血管把它打通。谢谢你。Okay. So hello everybody. My name is Paul Chiam. I'm a cardiologist in Singapore. I work at the Mount Elizabeth Hospital. And my subspecialty or my main interest is in interventional cardiology, which is a field where we do minimally invasive procedures using stents and balloons to open up the heart arteries, for example. And also, I am trained, one of the few interventional cardiologists who is trained in doing percutaneous valve treatments, which means that I can replace heart valves through a small incision in the groin under local anesthesia. And I'm also the only cardiologist in the Mount Elizabeth or the Parkway group of hospitals in Singapore that perform peripheral angioplasty, which is the ballooning and stenting of the arteries in the legs and of the artery in the neck. So this is my specialty in Singapore. So if you start with the coronary artery, as we age, we develop blockages in the heart arteries, and if you have diabetes, high blood pressure or high cholesterol, you are more likely to develop these problems. And also if you have a history of smoking, then there's a risk that your arteries may become blocked. So when there's blockage of the arteries, we can open them up by using a minimally invasive method where we use balloons and stents, something like that if you can see. So we insert a metal mesh, it's like a wire net, into the artery to keep the artery open. And this is a very common procedure that we perform. And in some patients, they may become very difficult to, the arteries may become very difficult to open because either the artery is completely occluded, which means we have to use a special wire to puncture through the occlusion, because once the artery is blocked 100%, we cannot see what is beyond the artery. So imagine if this is a passage and you block it completely, we cannot see it from one side to the other. We have to puncture through the artery. The second group of patients that we see that are difficult to do would be patients who are very elderly and who have a lot of calcium in the arteries. And when that happens, the arteries become hardened, and sometimes we cannot pass any balloon or any stent down the artery to open up the narrowing. And in these patients, we have a special device called rotablator, where it's a drill, very, very small drill, maybe just 1.5 mm. And this drill is coated with a diamond tip. And this allows us to drill away the calcium, and then we can easily use a balloon or a stent to open up the artery. So these are some of the very complex procedures that I perform for the heart artery. The next set of procedures that I do is to replace the heart valve without the need for open heart surgery. So if you look at this model here, so over here is what we call the aortic valve. In Chinese it is called 主动脉瓣膜. And this valve, as we grow older, due to wear and tear the valve may become calcified. Okay, and when it's calcified, the valve can no longer open like this, and all it does is to open like this because it's now stiff and the leaflets are all hardened and calcified. So instead of opening like this, it opens only a small hole. And once that happens, the patient will develop shortness of breath on exertion. They may have chest pain when they walk and may even develop fainting spells. Okay, so when that happens, we will need to change the valve. And the conventional way has been to have an open chest or open heart operation to change this valve. And for about 9 years now, we have a new method where we can come from the patient's leg. Again, a minimally invasive procedure done under local anesthesia, where we can change the valve using something like that. And let me show you an example of this. Okay, so these are two of the valves that we can use that can be changed through a catheter-based method. That means like a 成形术. And what we do is we can fold this valve in the procedure room, put it into a tube, and then on the tube it comes to the heart to be then open up where the valve needs to be. Okay, and therefore you can change the valve without the need for open chest surgery. And this can be done under local anesthesia, and usually they only require a 2 or 3 night stay in hospital, compared to open heart surgery where they are in hospital for about 7 to 10 days. Okay, so the third set of cardiac procedures that I do would be what we call a percutaneous or a minimally invasive closure of the left atrial appendage. Now, what is this about? In patients who develop a condition called atrial fibrillation, or AF for short, in Mandarin it means that the 心脏它的跳不规律. Okay, these patients with AF are at increased risk of stroke because the heart pump is not regular anymore. The top chamber pumps irregularly, and they may form small little clots in the heart, or known as in Chinese called 血栓. And if these clots come out of the heart and go out to the brain, the patients will get a stroke. So to prevent this condition or the patient from getting a stroke, the patients have to be on very powerful blood thinners, for example, a drug called warfarin. But for some of these patients on warfarin, they may develop bleeding, or patients who are very elderly or very old are at high risk of bleeding. And therefore, this method of closing the left atrial appendage with a device called the Watchman device has been shown to reduce the risk of stroke, and the patient does not need to take the very powerful blood thinner. So this is in fact an alternative option for patients to reduce the risk of stroke if they have atrial fibrillation or AF without the need to take the powerful blood thinner. And this is another procedure that I do that will help many patients prevent stroke and also reduce their risk of bleeding from taking the powerful blood thinners. So this is the Watchman a model showing what we do in the Watchman procedure, and the results of a 5-year study that was conducted in the United States of America was just announced about 2 months ago, and it showed that if you had one group of patients who underwent the Watchman procedure to close off the left atrial appendage, and compared to a group of patients who continued just taking the powerful blood thinners without closing the left atrial appendage, the incidence of stroke at 5 years was the same between the two groups. However, the group that had Watchman, because they do not need to take the powerful blood thinners, they had lesser risk of bleeding, and also we found that they had a better survival at 5 years, which means that less patients in the Watchman group actually died when you follow them up 5 years. So I think this is a very good result for this group of patients. Then I think the Watchman will be very good for these few groups of patients. And the patient population with atrial fibrillation or irregular heartbeats is very, very high. There are a lot of patients with AF because it is the most common irregular heartbeat that we see. The final set of procedures that I do as a cardiologist, and this is only very few cardiologists will do this kind of procedure, is what we call a peripheral artery intervention, which means in some patients who have diabetes, for example, who are smokers, who have kidney failure, they develop blockages or narrowings in the arteries that supply the legs or in the neck of the patient. And these patients may have a higher risk for stroke if the blockage is in the neck, or they may have pain in the feet when they walk, or they develop gangrene of the feet, which is something called 脚腐烂, 脚趾腐烂. So in this set of patients, what I do is I try to open up the arteries in the legs, but using the same balloons and also using stents like that, okay, to place them in the leg artery to help increase the blood supply to the foot and therefore relieve the problem of leg pain and hopefully prevent the leg from turning gangrene. Otherwise, in some of these patients, if the legs or the feet turn gangrenous, they have to have an amputation, or which means they need to chop away their legs. And similarly, we can also put this stent in the neck artery if it's a very severe blockage to reduce the risk of stroke for some of these patients with severe blockages in the neck arteries. So patients come to us through various channels. Most of them by word of mouth. A lot of patients, they have their friends and relatives come to us after they recommended by their friends and relatives. The second one is through doctors' referrals, colleagues who know that I do these procedures, and if I do them well, they will refer the patients to me. And I think the last one will be through online searches or through magazines, etc. So I think this will form the three main sources of where our patients come to look for us. As far as I know, I've been to China many times, and I know a lot of Chinese go to Japan for treatment, which I cannot understand why. So I would like to tell the Chinese people that Singapore is as good as Japan in terms of technology, and in fact, because our country is a small country, we get the latest devices much earlier than the Japanese do. So that's the first thing that I think we should know. So the latest technology and improvements come to Singapore first before they go to Japan. Number two, I think our country, as you know, is very systematic and organized, and the level of cleanliness and hygiene is very, very high. And all our doctors are educated either in the West, mostly in UK, or for like myself, we spent 2 years in the USA after our basic training to gain the advanced specialist skills. So we are really right at the cutting edge of the latest technologies and of the techniques. And I think Singapore is a very good place also because we are Chinese and many people speak Mandarin here. The food is the same. You don't have any language problems, unlike if you go to Japan, for example.